Thank you everyone for joining the webinar this afternoon. We'll just give a couple minutes for everyone to join. Alrighty, good afternoon everyone. Welcome to the Northwestern Melbourne Primary Health Network session on using PenCS in your practice and going through a cancer screening case study. My name is Claire and I'm part of the workforce development team here at the PHN and will be facilitating the session. Before we begin, I'd like to make an acknowledgement of country. The Northwestern Melbourne Primary Health Network would like to acknowledge the peoples of the Kulin Nation as the traditional custodians of the land on which we're meeting today. We recognise their continuing connection to the land, waters and culture and would like to pay our respects to elders past, present and emerging. Before we begin, I'd like to outline some housekeeping for the session. Participants are muted, and if you'd like to ask a question, we encourage you to use the Q&A function at the bottom of your screen. Your question will be either answered live or might have a type answer response. Please note that the session is recorded and that all questions and chat will be kept anonymous for your privacy. Lastly, please ensure your name in the Zoom meeting is correct. We do take attendance at the PHN and send certificates out to everyone that's joined today. So if your name is not the name that you used in the registration, if you could either send a message directly to us in Zoom at Northwestern Melbourne Education, or you can email us at education@nwmphn.org.au. And if you have multiple people attending on your screen, please do let us know so we can mark that accordingly. I'd like to just point out a couple of education sessions that are coming up towards the end of October and November. We do have a PIPQI session next week, which is great for all practice staff, and as well as some education on accreditation, residential aged care facility, new MBS items, and really exciting to launch the statewide PHN immunisation forum, which will be across 2 evening sessions. Now I'd like to introduce the 2 speakers of today, Manfred and Juliet. Thank you both for taking the time out to present to all of us today. Manfred is an account manager at PenCS with customer service and IT technical experience and a marketing background. He has over 15 years experience in GP networks and Medicare local, extensive collaboration involvement in many local and wide area public health service implementations. I'd also like to introduce Juliet, who works here at the PHN as a Quality Improvement Program Officer. Juliet is an experienced practice nurse and nurse manager and has coordinated several quality improvement projects on topics in chronic disease management. We look forward to hearing from both of you today, and I'll now hand over to Manfred to start the session. Thanks, Manfred.
Great, thanks, Claire. Now, let me share my screen. Yes, and share. All right. Just let me know if you can see all my screen.
That looks good.
Great. So I do not have a PowerPoint presentation. I do have a couple of slides which I might show in the end, but I want to hop right into the tool. As you can see, I've already Cat4 open in front, and on top I have top bar open as well. And I have, I'm using for this example, medical director. All right, now I want to show you a little bit what we have available in Cat4, and then Juliet will show you a little bit more how and why we are using the individual reports. So we'll stay more on the technical side. So as I have already gone ahead, I already selected my last, most recent data extract. I no longer need it, so I have already calculate the information into the more commonly used reports. in CAT4. And what we have available is, if we look into the filter tab, as you know, CAT4 is split into the two screens, the reporting screen and the filter screens. We in CAT4 have, under the conditions tab, you have filters for chronic conditions, mental health, and for cancers and cancer screening. Now, what the filters allow you to do is to filter for a patient who have a diagnosis of one or the other cancerous diagnosis. So if it is for blood and immune, you have leukemia, a lymphoma, and multi-melanoma. Now, the way, as you know, the way the filtering work in CAT4, if I'm interested in one or the other group, I can select that one to mark it, to set the criteria, and to filter for and to find patients which have that particular diagnosis. Now, if I'm interested in any patients which have a blood or immune system diagnosis, then I will use the yes on top, because in that way I'm creating an OR search. And with the OR search, I can find all the patients which have a blood or immune system diagnosis. And as you can see here to the right, I had to just move the little screen here to the right. There's a little recalculate button, which as soon as I set certain filter criteria, that one changes from black to red, indicating that I need to recalculate to show the number of patients according to their diagnosis. Now, what I will do now, will recalculate. And as you can see, I'm dropping from about 12,000 population to 66 patients which have a previous diagnosis of any of the blood or immune system. Now, you can use the filters in any way you like. You can be more specific and say, okay, I want to filter I just want to work with only leukemia patient, and then recalculate and find those patients, and then use any of the reporting tabs. I will just hide the filter tab just to maximize the report itself, to show you that once we're done with our filter criteria, that we then can look into what else they come back. And that brings me to my next tab I want to show you here is the disease tab in CAT4. Now, as you can see here, I'm still looking for patients with a leukemia diagnosis. We have in total 25 patients here, and we can see what else those patients have on diagnosis in the clinic. To that one, you do have the cancerous conditions as well. As you can see here now, those are my 25 patients I have been filtering, but my 25 patients do also have a lymphoma. They may also have a bowel cancer diagnosis. They may have a pancreas type of cancer, and so on. Now, the best way to work with that one, if you're interested in a report, for example, to say, okay, all my patients which have a leukemia, but also lymphoma type of cancer diagnosis, I would like to check, send to a health check or whatever it is, you can select it. You can use the export function on your report to output the list of patients with that combination, in that case with a leukemia and lymphoma diagnosis. And then you can invite them, if you like, to a checkup and so on by using the SMS or the voice recall system. Or if that is something you want to inform your nurses or someone or your doctors about, then you can print that list out or save it to an Excel file, then hand it over, and then follow up with further steps. So those are very quick ways. As I said, you can use the MBS eligibility in combination, that you say, okay, let's have a look how many of those patients are eligible for a health checkup. If it's now the 45/9, if it's the 75 plus, that is then entirely up to your search. But if I say, okay, let's take the two groups here, want to check the patients eligible for any of the two groups, then I can do that one. But because I'm having now a selection on disease, a selection on the health assessment, I no longer can use the export button. I need to do a cross-tabular report and combine it with the report button here. And as you can see here, it will tell you if those patients are due for a health checkup or when they had the last health checkups. So that's one way how you can use the filters in CAT4 to filter needs group to identify certain health outcomes or certain checkups. The other, what I want to show you is that CAT4 has also a range of tabs available for you. You can use. Now, in that case, let me please recalculate here. And what I will go here under the screening tab here. We have a number of tabs available. One is the cervical screening, the other mammograms and FOBTs. Now, when we look into the cervical screening, you have a breakdown. The green will always indicate that that they are within the framework, that the cervical screening is up to date. And then when you go into different colors like the red ones, that always will indicate that they are out of scope, that they are not up to date. And black we always use for did not happen or did not have a screening test and so on. And as you can see here as well, that we have an ineligibility section as well on your report, as in my case here, if we're looking into patients aged 25 to 74, we have about 295 ineligible because those patients may already have a certain condition which no longer requires a cervical screening test, and those ones would be women without the cervix, or which had a hysterectomy or a removal of the cervix. So they are excluded from your report. But then you can see here the ones which had a HPV in the last 5 years up to date, the patients which had a pap smear and no HPV, and a HPV outside the 5 years, longer than 5 years, or 2 years in the past. Now, what I do want to show you here as well in all those reports now in cervical screening and mammograms is, now, whilst you have seen, I have not selected any filter. Now, most of our reports, which are gender related, are already pre-filtered in the background. So that doesn't mean that you have to use a filter. However, in that case, I do want to show you something here that sometimes when you add a filter to it, the number changes, and I will explain that why. So if we think now we have a population of 4,828 in my report here, if I would filter just by female only, you will see that I'm dropping here by about 47 patients here. And the reason for that is that we by default also will count the not stated into the report. And the reason for that one is because we believe that sometimes some screening tests are relevant and important because they may prevent the worst thing from happening. And if someone chooses not to state a gender and so on, but we have a chance to look through the lists and identify those people, we might be able to talk to them in general practice, to talk to them and see, okay, look, we offering those tests and so on, would you mind doing it? Would you like to come on board? And the way you can do that one is you just select the two here and click on that one, which will give you the 46. Which have not stated and are not recorded. And if you wanted the list of that one, you just select it and click on export to identify those patients. Now, in my demo data, I have, unfortunately, it doesn't tell me the gender of it, but when you walk through the 46 patients, you will see that the one or the other by the name itself leads more to a particular gender. And then you might be able to contact those people again via SMS to say, okay, look, come in for a checkup or whatever it may be. So it's always a good way to make sure we have the whole picture. But if it's just if it's your wish just to look at the female patient or the patients which have identified themselves as female in your clinical system, then you're more than welcome to use the female as a reporting criteria and select it as a filter. Now, the mammogram filter, as you know, all our screening reports here are depend on the way how you receive your referrals, and that means the pathology results. If you receive them in an atomized way, then you will have the information coming into your clinical software automatically. And then it will be filtered into the right tables, and we can extract that information, interpret it, and show it to you as a report. If the information is not coming, then you would have to manually enter those results into your clinical software to make sure that you can then use CAT4 to extract that information and to present to you in a report. Now here the same applied when by default, if you don't select, we will have all the female patients in the recorded as female plus the ones which have not stated the gender. And we got a breakdown here recorded in the last, from 0 in the last 2 years as up to date, 2 to 3 years and 3 to 4 years, then the ones you will be then sort of looking for screening opportunities and so on. And then you got the ones 4 years on all the as not recorded. Again, we have a list of ineligible ones here as well, which are no longer are due to need because they might have already one type of cancer diagnosis, which no longer requires a mammogram and so on. So they are excluded from the equation here. And my last report I want to show you is the FOBT report. What we have available, again, it's split in 3 reports. The last recorded, as you can see here, the recorded again. And again, all our reports here, you can apply filter. If you wanted to do the FOBTs for a certain age group or for a certain condition, please feel free. You can say, okay, we do the FOBTs for I'll make it up now for 45 up, for example, and then use that as a filter. If that is something you want to do for patients with a chronic complex condition, if it's now one chronic complex condition, in that case, if it is for all your diabetes patients or your respiratory patients and so on, yes, you can do so. You can use the filters to narrow down the criteria and to filter for that particular audience you want to look into that for that report and so on. So in my case, I've just gone ahead and tick that one just to see. I just want to get out of the filters here again and get back to my default as it is. As you can see here, the last recorded is when they were last recorded. The other tab I'm showing you here is the FOBT by orders and result. As you know, you might have received a result back from a patient, but you never have ordered it. That is the one which were picked up at the pharmacy or somewhere else and or sent by mailbox, and the patient had nominated you as the recipient for that FOBT. Then the order was not you, but you will receive it. As you can see here now, we got where we have just the result only, which is a lot bigger. The ones which we have ordered and received, you got here in green, so that's 31. And where you have ordered only and so on, and you can see here 12 FOBT tests were ordered, but we haven't received the result for them. So there could be various reasons, and then you could actually pick that pie chart and talk to the patient group and say, okay, we ask you to do an FOBT test. How is it going? Do you have any questions? Can we help you? And so on. And so on. Now, the last report I will show you here is, before I hand over to Juliet, is the FOBT summary report. The report can be printed out. It basically gives you a tabular overview on your FOBTs for the various age groups. Might be a handy tool when you go into meeting or when you want to discuss the FOBTs with your staff and how you want to move forward with that one. Now, before I do that one, I do have a couple of slides, as I said, ready. There are some limitations to our group. So one is the cancer filter report only works with the coded diagnosis, as I said. So if there is no diagnosis, or if the diagnosis is free texted, we will not be able to report on that one. Cancer screening report have an exclusion criteria. So bear in mind when you look at the number and you think, hey, hang on a minute, we have issued a number of tests for those people, but only that number shows us tests. Be aware that if there's an exclusion criteria and if those patients do not meet the criteria of the reporting, then they will be moved into the exclusion criteria, and therefore your number might be slightly different. Cancer screening report reports on the outcomes. Okay, So it doesn't record on the future, the impact, it records on the outcome. And cancer screening relies on the pathology test names, so how they're coming back from your lab. As I said, usually if they're coming back in an atomized way, that they get automatically populated into your system, everything is good. If you receive a block, a pathology report which has an embedded PDF file or something, then you may have to enter them manually into the right places. Now, we do have in top bar, that's why I have top bar open here. We have for the PIPQI CRIM, which is focusing on the cervical screening, we have a report. Let me just put that one down here. And basically it's working with your clinical software here. And I have Carolina open now, and if I open the tab here, I can see that Carolina is missing a cervical screening, which was outside the last 5 years, so therefore she's due. Now you can basically, as I say, click on that information. It should open the place in medical record. Now you could either issue a referral for the pathology test, or you can, if you have the information, type it in. All right, that is my part. I hope I didn't get too much over. I want to hand over now to Juliet. Let me just see if I can.
Thank you, Manfred, and hello, everybody. Manfred, that was a really great overview of all of the filters for cancer screening and a whole lot more. Absolutely love top bar. There's just so much you can do with it. So that was a good opportunity to see that there. I'm going to share my screen now and do a little bit more with pen. Okay. All right, are you able to see my pen cat now? Yep, good, cat 4. All right, so I'll just provide a really quick overview. If there's any of you in the audience who are really super new to Cat4 and you're not really familiar with how to even get your data up, I'll just quickly talk you through that. But I won't spend too long on it. I have talked about that previously, and you can find our previous webinar videos on our website under the quality improvement section. But how you do that is when you log in at first. By the way, login tip, it's usually your initials and 1, 2, 3, 4. So try that if you've forgotten your login, your password. And if that doesn't work, right next to the login spot on that little blue square where you put your password in is the Pen help phone number. So give them a call if you need to reset your password. So that's the first tip. So once you're through that screen, you come to this and it's quite blank. So there's nothing here and there's no graph. It's just a big blank screen with a couple of icons up the top. You just go to over here, show extracts. If you click on that button, actually, what you would normally see is a list here with this ticked, and you'll have a list there, and that's all your identified data. We at the PHN and Manfred on his side, he's only seeing de-identified data. I might have said it wrong, apologies. You will have a list here of your identified data. So that will be the stuff that you can actually drill down and find out the names of the patients that you need to recall. But we don't have that. And that's why when Manfred was showing his screen before, you saw first name 261, last name 3 or whatever. That's our de-identified version. But anyway, so mine are all hidden in the de-identified part, but you don't need to untick that box. You'll actually have a list there that's automatically being generated month by month as an extract is pulled by the data extractor behind the scenes. Anyway, so you click on that and then you wait a little bit and it loads. And that's what I've done here. And mine has already loaded. You do have to be a little bit patient. There's a bit of a ball that shows that, you know, progress is still happening. So you just got to wait while that does its thing, but mine has already done that. Okay, so, and the other thing is when you have loaded your data, it usually looks like this and you're wondering where all of your filters are. And there again, you just click that little arrow there to bring your filters up. So here we are. So at the moment, we've got a population of 12,143. At the PHN, just about all the time, we prefer you to put in the active patients filter because we know that you're super busy in general practice and you probably don't want to be doing all of these activities on patients that maybe have only visited your practice once. So we're really trying to drill down and find the people who are regularly attending your practice. And that's what this button will do. Active 3 times in 2 years. So they've been to the practice or had a telehealth at least 3 times in the past 2 years. So if you click that one, whenever you make any changes up here, for them to apply, you need to click over on the top right-hand button. There's a right-hand corner. There's a button called Recalculate. Now, I watched a previous version of the webinar, and I found that the panel of us was covering it. So I'm just dragging across so you can see that momentarily. There's Recalculate. There's Clear Filters, which we sometimes use to remove what we've selected. And down here, there's Export. That was also covered in the webinar recording version. So just in case the same has happened again when we get to the recording stage, they all live over on the right-hand side there. So yeah, I've ticked that button, but you can still see we've got 12,143. It's not going to change until I hit Recalculate. But I'm not going to do that just yet. I want to add one more thing because we're going to check for, what are we doing first? We're going to check for people who need bowel screening. So they would be starting at age 50 and ending at age 74. Now, you can do an even fancier version of this with using number of months, but I don't have in my head, I don't know if you do, Manfred, the number of months that you start with. No, but it is in the pen recipe, so maybe you can have a look at that later. Recipes are all hiding away up in here in the help tab too, by the way. So yeah, you can do age 50 to 74 years, or if you want to get really specific and you're thinking, well, at 50 they usually get an FOBT kit sent in the mail, so I don't want to just recall them all immediately because they're probably about to get their kit. So in the pen recipe they use months, and they start at 50 years and 4 months of age, which I don't know what that works out to be in months, but it's a lot. Anyway, so I'm just keeping it simple, doing 50 and 74. And now that's all I want in my filters, active patients between 50 and 74, and I'll hit Recalculate now. And now we've gone down to a whole lot less, 2,152 patients. Okay, and whenever you do apply filters up the top here, or report selections, they'll all show in this middle band here. And I think Pensius has got a nice, lovely name for that band. But anyway, whatever that bit's called, it's always worth checking that what you want and what you've selected are the same thing, and they're showing there, because then you've got the right data that you're wanting to work with. So at the moment, that's what I've got, 50 to 74 active patients, but I want to drill down and find their screening. So I'm going to go to the screening tabs in the report section, and we wanted to find the people who need bowel screening. So here we go. I've clicked on screening and then FOBT, and I've got the first tab open, last recorded, and there's actually quite a lot. So we can see here 1,018 people not recorded. So we definitely want to recall them. We might also want to recall these guys who haven't had one in the last, say, 3 to 4 years, or maybe even 2 to 3 years. Depends how much time you've got on your hands. That sounds like a lot of work, but I'm going to sort of just go through the basics quickly, and then I'll provide some tips on ways you could slice this data even further and work out, sort of target groups within this group. If you're looking at that and going, wow, that's I don't have time to recall however many patients that is. But I would just, see, I can't even get across to my export button. I'll just move my little panel of panelists and hit export. And then there we go. It's just brought it up on my other screen. So I'm dragging it across. So it's 1,256 patients. So one way you could decide to slice this cookie is just to, I might just make it bigger, but not full screen, because I'm going over things. All right. So you might just decide I'm going to do the whole list from go to woe, but obviously it's way too big to print. So I'll just save it, and I might save it as an Excel spreadsheet file so that I can mark them off when I've called them, or mark them when they've said no, or whatever the scenario is. So that's one way you can do it. If you have a much smaller list, maybe you do some more filters and identify 30 patients, and you're like, right, I can print that list because it's only going to be two or three pages. That's your choice as well. So there's printing options as well there. The other thing about these lists is that you can also reorganize them. So I think, have I missed that opportunity? No. Oh, it's above. There we go. Just took a bit of time. So you can click above the headings and reorganize. Not all of the, well, you can actually click above all the headings, but you don't really need to reorganize all of those. You can just pick one, the one that's most relevant. In this case, you might want to contact this person first because he was last screened for an FOBT in 2009. So, and then I think, there we go. Oh, so just a bit slow to react. So sorry about that. In fact, I forgot I had the not recorded people in there as well. So maybe you want to call them first. They haven't had any FOBT at all. So that's that list. Now I will clear my report selections only. So I want to keep my filter selections because we're still going to do mammogram next, and it's still the same age group, and we still want active patients. But I will just clear my report selections. So to do that, you just untick this one because you want those filter selections to stay in place, and you just want to clear the report selections. There we go, I've done that. Now I'm going to go across to mammogram, and you can do the same thing for mammogram. There we go, 1, 2, 3, all of the people that are either overdue, these guys are overdue, and these are haven't had one at all. And as Manfred was pointing out before, if we just jump back to FOBT, so we see we've got active patients age 50 to 74, and there's 2,152 of them. If we jump to mammogram now, it's automatically changed. We didn't need to do anything to the gender data, male, female, we did, or not data, but the filters. We didn't need to add them because it's inbuilt into this to detect all the females and not stated and other. So, so that's a really good tip. You don't need to add that to the filters in these types of things like cervical screening and mammogram. That's already been done for you. So we've got 1,280 for these ones. So again, you can click on the ones you want and export the list, save and print, or whatever you want. Probably not print, there's a lot of people here again. Or you can just identify one at a time. So for example, you might say, okay, there's 71 people who are just overdue. They haven't had it very long ago, but we just want to remind them. So you might decide, okay, we're going to just work on this group first because they're you know, they're a smaller group. Or maybe, well, they've been screened more recently, maybe we'll do this group because they are quite overdue, but they have been involved in mammogram screening before. So that's an option as well. As I mentioned, I'll come back and talk about some more options in a moment, but I'll just show you one more, which is the cervical screening, age 25 to 74. And of course, I'll recalculate again for that one and go to cervical screening. And once again, always check that you've got the right filters that you want in there. So I do want people aged between 25 and 74, and it's automatically filtered just the females other and not stated. So, okay, and then again, you can select the group that you want, and either it's just whittle through those, or maybe you can go a little bit further. So we'll do that now. I'm thinking I've got a huge people at my medical clinic. So my imaginary medical clinic, obviously I work at the PHN, not at a medical clinic these days. But if I put these guys together, I've got 589, 700, 882 or something like that patients identified who haven't had a cervical screen or are well and truly overdue for a cervical screen. So that is still a lot of patients. And if I hit export, I can get that list, bring that across. And yep, sure enough. So if I just make that, no, I don't want to make that bigger. Just make it a little bit bigger. There we go. So we can, it's being difficult. Okay. There we go. So we can see, and it's another good practice to check at the top of your list that you've got exactly what you wanted. People who are 25 to 74, who haven't had screening or are overdue for screening. There's your criteria there. So that's good. That's exactly what you wanted. And that's also helpful because when you make a list and then say you come along in 6 months' time and you want to do a fresh list, you can check what your old list had, you know, what criteria you had in your old list and make sure that you've matched it in your new one. So you're comparing apples with apples and you can say, great, we had 882 back then and now we've only got 536 or something like that. Okay, so there's your big list. But say you're looking at that and going, oh my goodness, there's no way I can do that many people. But, you know, we've been having a chat as a clinic and we've noticed that, you know, we've got a group of Indian patients, for example. We've got quite a large Indian population in the northwestern Melbourne region. So maybe your practice might be having a high Indian population. So you might say, well, we've got a Hindi-speaking nurse. Maybe we could talk to the women who are not having screening. Maybe it's a bit of a barrier because nobody's really talked to them about how the system works here or whatever. Like, it's a bit of a leap, but it can achieve some really good outcomes in sort of subgroups of your population by thinking outside the square like that. So if you were to do that, you've identified all your people who are missing cervical screening. Then you want to find who are the people in there who might be Hindi speaking, for example. Unfortunately, we can't go, okay, we can't really go Hindi speaking. We can only go Indian ethnicity. But then at least you've got that option when you have a phone call with that subgroup of your list, that you can have that conversation in English or in Hindi if that person needs it. So this is a thing called crosstabulation, which is where you use the report section in one tab, like how I've got you can see the dot there on cervical screening and screening. And then you go over to a different tab and you want to combine the two. If you click on ethnicity tab and then go to ethnicity profile, and you can see a whole bunch of ethnicities there. Now I'm going to play with my panelist screen again. I just want to show you these previous and next buttons because this is what we use. We can see it only goes to Cypriot there and we want to go further. So I'm going to go next, and I think here's my Indian population here. Great. Okay. So now I've actually selected both people aged 25 to 74 and who are needing cervical screening and who are Indian. Now, if I click export, which is what I usually do to get a list, it's just going to give me what I can see on this report page here. So that's not much good. It's going to give me 43 people from an Indian background is what it's going to give me. And that's not, oh, maybe it's going to give me all of them. I can't remember. Actually, I think it's going to give me everybody. I don't want that. I want that combined thing. So I can't hit export in this case, and I can't hit view population. I have to hit report to get the two combined. So I'm going to hit report. It will grab it over here. And there it is. And having learned from last time not to do it the other way, there we go. I've got people aged 25 to 74, and there's 10 of them. So obviously that's a drop in the bucket for the people who are needing, you know, I can't remember, there were 882 or something people needing cervical screening, but it might be a way of addressing a small subgroup of your population who maybe aren't really aware. Maybe, you know, like some you're going to find have been here forever and they've just put their ethnicity, but they know the system and they know English is not a barrier and everything. But you may also find those people that do have barriers to accessing the healthcare system and screening. So this could be a really worthwhile activity just to find an underscreened group and really have a one-to-one conversation with them. Because, you know, when you pull a list and there's 10 people, or maybe you can actually make a phone call in that case, where when you're pulling a list of 800, you probably wouldn't make 800 calls. So that's one thing I wanted to show you. You can do this exercise on any of your other screening ones as well. So if you wanted to do bowel screening the same way, I'll just clear everything. And then I'll put in 50, 74, active patients, recalculate again, and say if we wanted to do bowel screening and everybody who hasn't been screened at all, and then you wanted to say maybe have a talk, maybe you've got a Chinese speaking doctor that can talk to all of your Chinese patients, and then you can hit report. And we've identified 15 people that we could recall who could maybe have that conversation in their native language, if that's an option in your practice. So yeah, you can use cross-tabulation not only for ethnicity, it sort of works for all sorts of different other tabs as well, but that's a really good tip. The other one is just if you, I'm just going to remove the ethnicity part and go back to the screening. If you look at that list and go, wow, okay, for FOBT, there's actually a really big number. What have we got in total? Just to export that. Got 1,256 people needing bowel screening. So I think I would be a bit overwhelmed by that prospect of having to call that many patients. You might go, well, this is everybody that needs bowel screening, but what about the people who are, they're sort of coming up to the end of, that period, that 50 to 74 year age group? Maybe we could talk to them first. And I don't know if any of you were around when the shingles vaccination came in, but this was something that we did to phase in the shingles vaccination. We had this big age group, but we were obviously trying to get to that cohort that were about to age out of that opportunity, that were, going to miss out on the vaccine if they turned to their next birthday. So we would get them first. And you could do the same approach here. So rather than calling in 1,200 patients at once, you might go, okay, let's just go the 72 to 74-year-olds. Let's identify them and have a conversation with them first. So you put those filters on, and then you've got 113. Oh, that's more manageable. All right. Well, we could spend maybe, let's make a goal out of it. Let's aim to get through 113 patients contacted and invited for a conversation with their doctor within the next 2 months. So let's say 50, 60 a month. Break that down to weeks. Okay, we're going to aim to do 15 patients every week or 2 patients every day on this list. So you can do it a number of ways, or you might just go, okay, we're going to export the list and aim to do 1 page of the list recalls every week, something like that. So just different ways that you can slice that, rather than looking at the big numbers that are typical when you use PenCat to do cancer screening activities. You do find these huge numbers and it can be quite overwhelming. But I thought that might be helpful for you, just to provide some ideas about how you can slice that various ways, and different activities that you might want to do, or zeroing in on different groups. So I think that's all I wanted to say about that. Just quickly, we might open it for questions in just a moment. But before that, I just wanted to share about the quality improvement activity library that's relevant to this. So I'm going to stop sharing my screen, and Claire's just going to share the last 2 slides. And we're really excited about this. So this is a piece of work that's been going on for a number of months now. We've been trying to get these quality improvement activities ready for all of the practices in our region and even beyond, that they can sort of have supported templates to work with, to come up with, they don't have to come up with all the ideas on their own, basically. So this is new. It's just gone live today on our website. It's the QI Activities Library. So I will be giving you the web page. In fact, it's down the bottom there, nwmphn.org.au/QI-activities. You should be able to find it in our library in our menu under quality improvement, if not today, within a coming day or so. But they're just fresh off the press. So this is what the page looks like. And Claire, if you can click on the next one. Oh, sorry, I forgot to mention there's a bunch of animations on this page. If you scroll down the page, you'll get to one of the menu items called cancer screening, and there are the first, sort of the most common cancer screening activities that you would do to identify patients aged 50 to 74 for breast screening. So all the stuff that we've just gone through in the PenCat tool. But these activities go a little bit beyond that. So it's not just how to identify your data in the PenCat tool, but also looking at ideas to help you, bring these activities to life, I guess, or think of how you can do these quality improvement activities in your practice. So, for example, there's ideas about maybe you could use a card at reception to give to people who look like they're the right age demographic for breast screening or cervical screening, to prompt, things like that. There's links to resources in other languages, all sorts of things. So there's a whole lot of different ideas that you can incorporate into a quality improvement activity in these three areas. And there's also some other topics as well that aren't cancer screening. There are more to come in future as well. So how to get an activity, say you want to do that first one, identifying eligible patients for breast screening. You would click on that. It gives you a little bit more of a rundown about what the activity is about and some of the ideas that are included. And at the bottom of the page, it has this blue box where you put in your details, your name, your first name, your last name, your organization, and your email address. You probably can't see that well enough, but don't do what I've done. I've just put NWMPHN. Please do put your full practice name so we know where you're from, because if it's GPMC, it could be a whole lot of medical centres. And that would be really helpful for us. And then you can click instant download, that navy blue button on the bottom. So when you've got the activity looks something like this. This is just the first page. It's actually a template, so the following pages do actually have bits where you can either print it off and write in there, or you can keep it on your computer and actually type in there in Word as well. So that's really handy, and we definitely encourage you to keep the completed activity as part of your quality improvement records, because that is all part of your PIP-QI incentive payment. So I think that's it from me. And if you do one more click, Claire, it will just give us one more now. There we go. That's the web address again. So I think that's it from me. And I think we've got just a couple more minutes if anybody has any questions for me or Manfred.
Thank you so much, Juliet. That was amazing from both of you, and really excited to see the launch of that QI activity. I think others will as well. We did have a couple of questions which I'll go ahead and shortly ask. Manfred, did you want to jump in and say anything before I ask those questions?
Yeah, look, as you had pointed out with the multi-language, if I can share my screen just for a second. I just want to show you, it may not be quite that, but something very similar. Let me just share my screen. I will then stop in a tick again. So, right, here we go. As you can record, and that does not apply to all the clinical softwares, but there are some clinical softwares which allow you to record the ethnicity of your patients outside of Aboriginal and Torres Strait Islander. So it does allow you to pick from a list, or it allows you to actually add to that list. And I think one of them examples is medical director, for example, and I'm not sure if best practice is one of them as well. But if you see that the ethnicity is recorded and given you are recording it in your clinical software, then we will extract it here and can provide it as a list here, and then you can actually pick the people of that particular heritage, of the particular ethnicity, and then search for patients with that particular coding. So let me just see if I have any. I'm not too sure if I have any data on that one, because as I'm working off a demo data, so I probably won't have any information on that one. But that might be what you can use to filter for a patient with that background, with that ethnicity background, and then build your reports, your FOBTs. Like Juliet said, you might need to talk to them slightly different. You might have to find someone who speaks their language and so on. So that's probably your best way to identify those patients, provided your clinical software supports it. So not all the clinical products support that type of information collection. So
yeah, that's good. Thanks, Manfred. I forgot that was in the filter section as well. And in best practice, you can. It's kind of not obvious at first, because I think you have to put other and then the option to pick from a drop-down box happens. I think, but I'm a little bit rusty. I'd have to check that one. Maybe somebody who's a current best practice user can comment about that. That's cool.
Thank you for sharing that, Manfred. There is a couple of questions which I'll launch into now. So someone had asked for gender, especially I think this was asked during the, was it the cervical screening? What about trans men for breast screening, sorry, that are recorded as male in the practice system?
Yeah, that's a really tricky one. It's obviously not going to pick that up just like that. So I guess it would be probably a really good idea for, and this could be a potential quality improvement activity for the practice as well, for the practice to develop a bit of a log of the people who maybe, you know, a gender diverse, and maybe may not be detected in those types of activities, so that you know, we could identify them separately, I would say is probably a better way to do it. So maybe to talk to each doctor in the practice and say, who are your gender diverse patients, and develop a bit of a log of those. So whenever an activity is done, just to also check that and see who is, you know, possibly needing the same attention that way. Might be a way to do it. Have you got any thoughts on that, Manfred?
Well, I have to hang on. Unfortunately, it's very difficult, because from the report itself, it's picking up females, others, and not stated. Now, the only way to bypass that one is, and again, that probably is not a good solution. I think the best is really to note it down and then work with them outside the tool separate. If it would be that it would suit, you could state the patient as other in the clinical software, that you use that function to categorize people which might require special or different care as that one. I'm not sure from a software point how. I don't think we would have to find out if the software itself does allow you reporting that breakdown to what the gender or what other specifications are for us to pick up. If the software would allow that one, surely there would be some ways that from a software point we could accommodate for that one. But I think due to privacy issues and other concerns, some people do not want to share their gender, or don't have hesitations about that one. I think that's where the software market is slightly a little bit hesitant as well to come on board on that one. I think Julie got probably the best solution here is really to work outside them on your own lists and
yeah. But I think your idea is a good one, Manfred, because if you know, if you do have these people that you've identified as maybe, you know, they've started genetically one way and are now identifying as a different way, maybe a really good approach would be to have a nice, you know, gentle, compassionate conversation one-on-one with that person and say, for the purposes of risk detection and management, would you be okay with us putting your gender as other rather than male or female, so that we can find and screen, you know, where appropriate, you know, when we do these larger scale searches, that you would be included in that kind of screening and prevention activity. And I think if you were to have that kind of conversation in a really open manner, you'd probably meet with success most of the time, I would say, and that would probably be a bit of a better long-term solution, because they ultimately would be coded in a way that they can be detected for these activities, which is great. If there was a response of no, I don't want that, then we'd have to do it as a manual log and keeping tabs on their screening separately.
Now, I just see that I think it was from Kim about the gender diversity and that they are being recorded on the others. Now, what we, as I've shown, that by default, if you don't apply any filters, you filter for the particular gender. Now, with cervical screening, you're looking for everyone who is diagnosed with, not diagnosed, who is recorded as a female patient. That's coming out as a primary. However, we also put in that report by default everyone who is a status other or not stated, and that allows you to, as a clinician, to basically pull out the list. And that's why I showed you the report, that I could actually go into the same report, switch on filter for other and not stated to get the list of those patients, and then I can look through the list and say, okay, hang on a minute, now that is a person who does not want us stated because of a personal reason, and there's someone who might want us stated for a different, slightly different reason, but will benefit from the care. It's then where you as a clinician then make the call and say, hey, yes, I found that one. I know that patient. I talk to, like Juliet said, I take him to a conversation. I talk to them in a private manner and explain it and work through that list in that way. So in either way, if it is for any type of screening, the others we will keep in our reports by default. If you wanted to exclude them, please tick it and just the gender. Then you will find out those recordings will be then excluded.
Thank you both. And thank you for the question as well. I believe Juliet has answered the second question in the chat, but it was just asking to state the login and password tip, which I know others would appreciate as well. I think, is it your first and last initial and then the password is 1234. So yeah.
So it's so the password is usually your first and last initial and 123. So mine's JF1234, which I don't mind sharing because you're not on my system, so that's fine. Anyway, I've got de-identified data. It really doesn't matter at all. But yeah, and if that doesn't work, then do contact PenCS, and their number is on that login blue box, that login screen that you see at the very start. So
thank you, Juliet. I just as closing the session, I wanted to mention about the previous webinars that Juliet had discussed at the start of the session. So including this one and other Pen ones will be available on our website. It's under the Events, News and Resources tab, and then you can click Resources Library under that. So they'll all be filed there, but you will also get sent the recording as well. I've popped an evaluation survey link in the chat. So if you have some time, we would really appreciate your feedback on the session. And we have taken on feedback and improved these lunchtime ones. So it does really mean a lot to us if you have the time. And yeah, just thank you for spending your afternoon with us, and thank you to